Hi everybody. Today I am answering the question, why do the elderly fall? And please note, this is a follow-up video to the video that I previously did called Identifying Complications of Elderly Care, where I identified falls and one other condition that relates to a lot of other health conditions that older adults experience. So a lot of caregivers are asking about falls and how do I prevent falls and what causes falls. Well, again, like many conditions, this is another very broad topic that encompasses the idea of having multiple health conditions, sensory issues like poor vision, risks in the home like rugs and cords that you can trip over, medication interactions, physical weakness, poor balance, poor nutrition. A lot of things can cause falls. So for this video, to kind of keep us on a narrow road, I'm going to share things to look for that will indicate that a loved one may be at a greater risk for a fall. And I'm also going to share information about a deep dive program that includes all of those topics that I just mentioned in one place that you can access absolutely free about falls and fall prevention. So stay with me. The other thing I'm going to talk about is a new Medicare program that offers caregiver training for patients. These are the people that you care for. The healthcare system likes to call people patients, specific to activities of daily living that relate to physical activities that include people having difficulties with mobility and falling. And the healthcare system uses the term activities of daily living, ADLs, Apple, David, Larry, to describe these. So the good news is the government that creates all these healthcare programs and manages your healthcare insurance through the Centers for Medicare and Medicaid if you are over 65. And a couple other community organizations are offering more help to family caregivers. Why? Because you're the ones that actually keep loved ones at home through your efforts. You are the loved ones who bring loved ones home from hospitals, who keep them out of nursing homes. So finally, caregivers are getting some recognition and some support. I'm Pamela D Wilson. I'm a caregiving expert, advocate, and speaker with almost 25 years of helping caregivers and older adults and people with disabilities manage healthcare. I respond to your questions here on my YouTube channel by creating these videos. So please click below, like this video, follow my channel, comment below, even if it's just to say, hey, thanks for the video, give me an idea for a future video that I can do for you. Also go over to my website. It's PamelaDWilson.com. There's a lot of free resources there, classes. You can schedule a one-on-one consultation with me if you are a group or organization looking for a speaker about elder care and geriatric care and caregiving. You can contact me there and let me know how and where I can show up. So I'm going to go through a top-line list of signs to recognize that loved ones may be a fall risk. Again, more detail forthcoming. And I'm going to put a link below to where you can find this in-depth program on my website about falls. So, furniture walking. Do your loved ones walk around the house and they're grabbing onto the couch and a chair and a table, anything to support them from tipping over because they have poor balance? Things that are preventable: clutter in the home, loose rugs, cords, slippery surfaces, stairs without rails, pets that run underneath your loved one's feet. I remember years ago, I had 2 dogs. I had a staircase. I'm coming down the steps. What happens? The dogs run behind me, they hit my feet, and I go flying down the steps. Happens to everybody now and then. It's worse if it happens when your loved one is 65 or 70 and has frail bones and then has a fracture. Any rapid change in health condition that results in a loved one becoming physically weak can result in a fall. So infections like pneumonia or a urinary tract infection can make loved ones become physically weak and a fall risk because of the infection. So if you see that, don't wait. Seek medical care. Get your loved one to a doctor. Get them to the emergency room because these infections can go from bad to worse very quickly. Quick story on this. I had a client years ago I was the guardian. He lived in an assisted living community. I visited him one day, doing great, walking, everything. Next day I get a call from the care community saying, Pamela, John needs a wheelchair. And I'm like, why does John need a wheelchair? He was fine yesterday. They're like, well, he can't get out of bed today. And I'm like, it's something else. Take his temperature, take his blood pressure. Did he sleep last night? Etc., etc., etc. Well, through that line of questioning, I discovered that he had low blood pressure, he had a fever, his pulse ox was low. Take him to the hospital, he has pneumonia, okay? Their solution was a wheelchair. My solution was hospitalization to treat pneumonia. So never assume that just because your loved one is weak, it's like that's what happens because they're old, because it's always not the case. There could be something else going on. So, any type of physical weakness, your loved one sits in a chair all day, they don't get up and walk. What's going to happen? They're going to become physically weaker. Their balance is going to get worse. They're not going to be able to stand, at the kitchen sink and do dishes or stand and make dinner because they're just weak and they're a fall risk. Diagnosis of health conditions, especially dementia, Alzheimer's, Parkinson's, arthritis, heart disease, high blood pressure. All of these can increase the likelihood of a fall. Then we add to this medications that we take for those conditions. So there are some medications that are risky for people over age 65, like pain medications, some medications for incontinence, depression. They can cause people to become more unstable. And then we have, loved one falls, breaks something, fractures a wrist, a hip, vertebrae, they have a knee replacement, hip replacement that affects walking. They are more of a fall risk until they do therapy and regain their physical strength and balance. And so the challenge in talking to loved ones about what I call either participating in physical therapy or fall prevention using a fall prevention device is this catch-22. So elderly parents are going to say, oh, I'm fine, I don't need that, right? I don't need physical therapy, I don't need to use a walker or a cane. Well, that's kind of a good attitude to have in some ways, because if they will walk and exercise and do strength training, then that's the solution, right? And if they don't do that and they start using a cane or a walker or a wheelchair, they're just going to become more physically weaker. So there's this area of opportunity, this window of opportunity to improve physical condition or have physical condition decline. So consequences, as we haven't talked about, are physical injuries. You fall, you break something. You have surgery, you go to the hospital, you go to the nursing home. Then it takes a lot to recover from these injuries, especially for older people who may not have been healthy or active in the first place. I can tell you over the years I had so many clients who could have prevented a fall, but just weren't interested. They didn't understand the consequences. And so they ended up permanently living in nursing homes for the rest of their lives. Now know this, sometimes family caregivers think that, well, mom or dad aren't safe at home because they could fall. So an assisted living community will be better. Well, yes and no. At assisted living communities, there's people around 24 hours a day, there's pull cords, ways to get help in the event of an emergency. But moving a loved one from a house to an assisted living community alone is not going to stop them from falling. Physical therapy and exercise and strength training can stop them from falling, in addition to looking at their medications and their health conditions. People can fall anywhere. They can fall at home, they can fall in a care community. The hope I know of caregivers is that at least if mom or dad falls in a care community, someone is going to find them sooner rather than later. So as I mentioned, on the topic of how to prevent falls, injuries, weaknesses, and everything that affects that, there is an entire module on my website, PamelaDWilson.com. It is under How I Help, Caring for Aging Parents webinar program, module number 4. The link is below for lots of information on this. So the topics in the webinar program, let me share. Question, answer. Why are elderly at risk of falls? Why do people with dementia fall more often? How to talk to parents about health and falls. All the chronic diseases, all the health conditions that contribute to falls, I talk about that. And it includes a segment on why do elderly parents resist canes or walkers? Well, of course, because they're not old and they're not going to fall. How to assess the home safety risks in your parents' home is part of this program. I share a list of home safety products. Talk about risks of falling in the shower or the bathtub. Why elderly parents don't want to bathe? Well, they've probably fallen and they don't want to fall again, but they don't want to tell you that, right? How incontinence can contribute to falls. And just all of the importance of looking at all of these things when you're trying to figure out what is going on with mom or dad. So also in this program, there's a lot of links to research articles because I fully believe in research that supports why we do something or why we should do something or look at something. There are fall assessment documents. There's a frailty index, things that can help you learn about falls and fall prevention. So be sure to go over to my website and check that out. Now I want to talk about this Medicare program that I mentioned earlier. I'm going to state some articles and resources. So it's the 2024 Medicare Physician Fee Schedule. You can find this on the internet. It includes a benefit to train family caregivers. And this is a result of the 2022 National Strategy to Support Family Caregivers. So basically it took them 2 years to come up with its programs that really is a benefit that actually pays physicians and pays qualified health professionals to provide either in-home or group training for caregivers. Because if they don't get paid, they can't do it because they're spending their time on something that's not billable. Well, now it's billable. Now they can do it. So they can provide assistance with what I mentioned before, activities of daily living, ADLs, which include transfers and mobility and how to walk safely, how to use canes, how to use walkers. There's a lot of other caregiver support training available through this program, which provides, again, these billing codes. And the reason that I bring up the billing codes is because CMS, the Centers for Medicare and Medicaid, constantly put out all these programs. To get to your physician, they have to go through the healthcare system or a hospital system, and somebody actually has to put the information in the computer and then tell people about this. So you may know about this program and you may call your doctor's office and say, hey, I want to come in, I want my parent to have this benefit, and they're going to be like, what are you talking about? Okay, so A, you have to have a doctor's appointment to be able to receive this training and these benefits for your loved one. They have no idea what you're talking about. Tell them that you know there's a program through the 2024 Physician Fee Schedule and Rule, and give them what are called the CPT codes for caregiver training. This is how they get paid. The code numbers 96202, 96203, 97550, 97551, and 97552. Honestly, if you tell them this, they are going to be amazed that you know about this benefit and that you are this educated. Having this type of information about Medicare programs and benefits helps caregivers and patients learn how to navigate the healthcare system for your benefit, rather than feeling that you're trying to get all these benefits out of the healthcare system and they're saying no to this authorization and they're denying that and they won't do this. Well, turn the tables. Get the care that you need. There are other videos here on my YouTube channel about Medicare and Medicare-specific programs that you can ask your doctors about that they may not know about. But this helps you. It puts you in a position of advocating and getting the care that you need for loved ones and avoiding falls, fractures, hospitalizations, and nursing home stays. I'm Pamela D Wilson. I thank you so much for being here. Please, again, click below, like this video, follow my channel, comment so that other people can find these videos. Go over to my website. The link is below. Find the Fall Prevention Program and watch the webinars, watch the videos, because this can greatly help you and your loved ones. Again, thanks for being here. I will see you all again very soon in another video.